Hey guys, it's Katie and this is My Life with VEDS. Today I'm going to tell you what it's like living with VEDS in the sense of the emergencies that I am prone to. I want to take a second and make sure that everybody knows this is not a substitute for medical advice. This is not me giving medical advice. If you think you're having an emergency, please don't watch this video. Please call 911 or go to your nearest emergency room. This is not the video to watch if you think you're having an emergency. This video is more about what emergencies I have to be looking out for as somebody with VEDS or Vascular Ehlers-Danlos Syndrome. Also, another disclaimer, this video is not associated with the VEDS movement. None of my videos are associated with the VEDS movement. Feelings and beliefs and content in these videos are just my personal opinion and perception living with VEDS. If you have VEDS, you are probably already familiar with the information in this video. This is really for people who don't have VEDS and just want to know what it's like living with it. When I got my VEDS diagnosis, I remember looking at my emergency passport from the University of Washington that had all of these emergencies listed in it and thinking like, holy cow, this is scary stuff. Bowel perforations, uterine ruptures, artery dissections and ruptures, aortic dissections and ruptures. It is very scary living with this diagnosis, and it's really difficult too because you kind of live in a state of catastrophic thinking because every new pain could be something. For instance, before I was diagnosed with VEDS, I had an internal carotid dissection, which is an artery dissection in the internal carotid artery. And for me, it was on my left side. If you've heard my diagnosis story, you're probably already familiar with this. But I had this dissection and it recurred multiple times before I got my diagnosis of VEDS. The artery dissection itself was not diagnosed until after my diagnosis of VEDS. And because they didn't know I had VEDS, they didn't look for an artery dissection. This was a mysterious, recurring, severely painful event over and over again for 1.5 years because they didn't know that I had anything wrong with my arteries and that I could spontaneously dissect them. My first carotid dissection happened when I was sleeping. So I woke up with it. It happened again when I was getting ready for work one day. It happened again when I was in the shower. There was really no rhyme or reason to why it was happening. It was just spontaneous, and at the time I didn't know it was a dissection. I thought that I was doing something really wrong that was causing these events. With VEDS, I know that I'm prone to spontaneous artery dissections, including my aorta. Anything that I do, if I have a new pain, I am thinking about whether or not it could be a serious thing. So because I have VEDS, the internal layer of my artery wall, like let's pretend like this is an artery and these are the artery walls and there's 3 layers each. Because I have VEDS, the internal layer can tear, which is called a dissection. A dissection is where the full wall does not rupture out and you're not bleeding internally. But this internal layer does tear, and that can cause ballooning if the blood goes in there and starts pushing out, which is what I have in my dissection. I have a pseudo aneurysm, which is like that little balloon. From that, I think it can actually fall inward and cause a blockage because now there's a little flap in there. I think it can clot and cause some problems. This is a patient perspective, but that's what I know about dissections. And I am lucky that in the 1.5 years that I had this dissection over and over again, that all I got was a tiny pseudoaneurysm and that it has not grown. It has been consistent over the last 3 years that we've known it was there. It has not grown at all. It must have done some type of growing at some point and then it just stopped, which is a big relief. But that's what happens with a dissection. With a full rupture, like the whole thing tears and you're bleeding internally, which is a whole nother scary experience. I did have a small artery rupture when I fell down the stairs last year, which I talk about in my pain-anxiety video, but I should have been more cognizant knowing that I have VEDS, that, I had spontaneous swelling, like very rapid swelling, and I almost passed out, and I just really should not have ignored this, and I was lucky that it was a smaller artery and not one of the major ones, which I think it would have been hard to ignore. If it was one of the major ones that ruptured, I probably would have passed out, but I got very lucky. I felt like I was going to pass out and then I didn't, and then I got on a plane for 8 hours, and I was very, very lucky. I joke around that the reason that turned out okay is because I sat on it and it was on my butt, so it kind of like provided compression to the area. But I don't know if that's what really helped or not. I'm not a doctor, and I should have gone to one. So the aortic dissection is also something I'm constantly looking out for if I have chest pain or back pain even. But that is where the largest artery in the body has a dissection. And because it is such a high power vessel and like so much force is going through that thing all the time, that can be deadly very, very fast. So anytime that I have a new serious back pain or serious like chest pain or anything, I am thinking about an aortic dissection. I will put a link to a really awesome page on the VEDS movement website about the symptoms of these emergencies so that you can go and check them out. I think it's important that we as people with VEDS know to watch out for these things and know what they might feel like. I know that I'm at risk for a bowel perforation as well. And I was told after diagnosis that that is, something where I would probably feel a pain in my lower left abdomen, and that it would just get worse and worse and worse, and that would be from my colon perforating, which means that there can be a tear in the intestinal wall, which can cause me to go into sepsis if it's really bad, or if it empties stuff into your insides, like the stuff that's supposed to stay inside your intestines, if that goes outside of your intestines, then that can be pretty bad, and that is a very serious medical event. I try really, really hard to manage my intestinal bowel health so that I don't have a perforation, but sometimes it seems almost impossible, and I'm going to talk about that in another video at another time when I tell you about my GI symptoms, which is kind of embarrassing, but we'll talk about it later. I know that other organs can also rupture, specifically the hollow ones. As a woman with VEDS, if I still had my tubes and I could get pregnant, then I would also be at risk for a uterine rupture in the 3rd trimester of pregnancy. I felt like I never wanted kids and I never wanted to be pregnant in the first place, so I went ahead and had my tubes removed, and that was a careful decision because I had had several mini strokes and I really couldn't do birth control. With my history, it was really difficult, and I knew that I would never want children, so I just went ahead and did the surgery at a center that was able to handle the risk of emergencies that could happen with the surgery too. That was a very personal decision that I can talk about in a future video, but not today. So I also have to watch out for lung collapse or bleeding lungs. Both of those are possibilities with VEDS. I'm lucky I have not experienced those. I don't know what it feels like. I know other people who have had several lung collapses and people who cough up blood regularly, and I really feel for them because that has got to be very scary to have happen over and over again. I also have to watch out for something called a carotid cavernous sinus fistula, or CCSF, which some people just call a fistula. It's because it's a mouthful. But those can, from what I understand, can cause like late in the game, like a bulging eye that can cause redness and may even cause blindness if it's not treated, but that's a problem, I think, with the artery and the vein behind the eye. And again, this is a patient understanding, not a physician's understanding. And that can happen spontaneously too in someone with VEDS. I'm lucky I haven't had that happen. I have a pseudoaneurysm in my head from my internal carotid dissection, which is actually not far from the eye. It's kind of like in between the eye and the ear over here. For me, I can sometimes hear it in there, which is similar, I think, to the sound that people get when they have a carotid fistula. They talk about how they can hear like this whooshing sound, which is pretty scary. I think my friend Annie described it as a washing machine in her head, and I just I also know with VEDS that I'm prone to aneurysms, which is why every year or so I have scans all over my body to check for new aneurysms or new dissections that I didn't have before. So it's really a constant monitoring situation because emergency surgery with VEDS is not as successful as planned surgery with VEDS. So we're always on the lookout for new things and we're always making sure that I'm okay. So as you can see, there are a ton of emergencies that I have to watch out for with VEDS that are life-threatening. I also just had a ton of stitches and stuff, but that to me is almost like no big deal now because it has happened so many times. The major ones that I'm worried about that I keep in the back of my mind when I have a new pain are an artery dissection, an artery rupture, an aortic dissection, a bowel perforation, a carotid cavernous sinus fistula, or lung collapse or bleeding lungs. The list kind of goes on. Uterine rupture that I'm not very worried about, but other women who are pregnant do have to be aware of as a possibility. When I first got that emergency book, my friend, I was really upset that there were so many spots for me writing down what emergencies I could have, and my friend just made it so much better when she said, "Oh, hey, they think you're gonna survive all of these emergencies." Like, thank you. You are the best friend ever. Thank you guys for watching. If you made it to the end of this video, I really appreciate it. Go ahead and hit the subscribe button if you'd like to see more videos on my life with VEDS. Also, I will put some information in the description box of this video for where you can learn more about the emergencies associated with VEDS. This video is not associated with the VEDS movement. This is just me sharing my personal perspective living with VEDS and knowing the types of emergencies that I'm prone to. So thanks for watching and we'll see you soon.